Good evening, everyone, and welcome to our training tonight, BioNutriShape Protocol, bringing shape, structure, and skin quality to the face. Please welcome our expert for tonight, Dr. Mihai Gorj, facial aesthetic surgeon in France. Hello, Mihai.
Hello, how are you?
Very good, thank you. Dr. Gorj is among us tonight to share with you his various techniques. So if you have any question, please feel free to ask them on our live chat. I wish you a good evening and an excellent training.
Thank you. I'm very happy to be here with you.
We're very happy to have you too. So just to start, could you please give us a bit of an update on the BioNutriShape protocol?
Well, the BioNutriShape protocol is a protocol that was designed by FieldMed laboratories. And it's a nice protocol because you can treat in only one session skin quality, shape of the face, and the structure. And it's meant for the patients that have a little bit of loss of structure. As you can see, you will use an NCTF, which is the biorevitalization product from FieldMed, and the volume, which is a filler that will provide the shape and the structure of the face.
Perfect, thank you so much. So now to go a bit into technical details, can you please describe the aging process?
Well, as you all know, the main point is that you have different ways of aging. You have alteration on the skin quality, you will have a lack of activity of the fibroblasts, and you will lose elasticity. You will also have fat loss and ligament loss, and in the end you will have bone loss. So basically, as you can see on the picture right now, all these three elements are mixed together, and the nice way to treat them is to treat them one by one, not to use only one technique to treat the three of them.
Okay, and so to go into more detail, what is happening in a sagging face?
Well, as you can see, the first point will be that the skin will have the wrinkles and will lose its elasticity. So that's what we will treat with the NCTF, which is the product that will enhance the skin. You will lose some fat tissue. You will have a thinner layer of the fat, and also the ligaments that retain the fat will become thinner, and then you will have a sagging of the skin more and more because of the ligaments that will have the loss. And in the end, you will have the bone resorption, and that's when you will have even more loss of volume of the face.
Very clear. And so from this point, how can you reshape it, a sagging face?
Basically, the protocol was meant to choose strategic points on the face that you will have to refill, some deep injection that will shape the structure. You will also have some other injection that will help shaping the face, and another type of injection that will help with the skin quality.
And is there a specific approach in terms of gender differences?
Yes, sure. What is really nice in this protocol is that it's adaptive to all of the patients. You can adapt to a really thin woman, to a man, and it's interesting because if you follow just a few simple rules, you can adapt these techniques to have perfect results even in men or women.
Great, thank you. So can you please just explain more precisely how BioNutriShape can be individualized for specific needs?
Yeah, sure. In fact, what you will want is, for example, choose the interesting non-mobile points of the face, and this will be the structural points. Let's say the chin, the cheeks, the mandibular angle, or the temple. And you will also want to replace the fat on the mobile face. And that's when you will be not that deep, maybe a little bit in between, not superficial, not too deep, and you will inject the volumizing product. And in the end, the skin quality, which will basically help nourishing the skin from the inside. It's like the same effects as a mesotherapy, but with a deeper injection with a cannula.
Okay, so and last question before we actually get to it. Can you explain to us the techniques that are used to optimize the results?
Yeah, sure. In fact, I think what is really nice about this protocol is that every doctor can use his own injection techniques, and you can use either a needle or a cannula. And if you follow the simple rules of drawing and preparing the injections, you can use what technique you like, and that's what we'll see tonight. On one half of the step phase, we'll use a needle, and on the other, we'll use a cannula. So you will see perfectly both differences and how you want to do it. On this slide, it's really interesting because you can see the gender differences. For example, the drawing of the main lines is the line that goes from the corner of the eye to the nostril, and the parallel to this line coming from the corner of the mouth. And that's how you will see the median point. It's the point that crosses the cheekbone. And then you will, if you want to go for a more female face, you will want a more rounded face, and so you will go more lateral. If you want to go to a more masculinization, you will go more medial for a man. It's the same for the chin, for example. In women, you will want a medial point, only one injection to make it round, and for the man, you will want a square chin, so you will have 2 injections. And same for the mandibular angle. Maybe you will inject it with more softness to a woman and a little bit more boluses for a man.
Great. Thank you so much for all this technical approach. So now I guess we can get right to it.
Okay, perfect. So in this case, we have our patient here, and as you can see, we are going to prepare to see. We took some pictures from her in 3D motion. I can show you right now, and then we'll come back to the patients if it's okay with you guys. Yeah, sure. So here we are. Here we have the pictures of the patient, and basically we can see that in this case, her temple area is really empty, so that will be one focus point on her. We can also see that on her cheek, she has a lot of loss on the lateral part, and as we go on the mandibular angle, she has a complete loss of the mandibular angle, and that's why she loses the support, and that's why you have all the sagging skin here. So, as I told you, I'll briefly draw it on her. The main points will be an injection onto the temple area. Some injections will be to the cheek. Some to the mandibular angle. We'll have this will be for the support. Then we'll want to fill all that's empty for the shaping and the skin quality. So let's do it on the patient. Okay. So could you just turn your head? Regardez un petit peu à gauche. Parfait. So, as you saw, the area that we want to fill on the temple region is this area. The main entry point will be here. In the point, if you inject with the needle, it will be the point that is the deeper. Then we'll draw the marking lines. It's the line going from, yeah?
Yes, sorry to interrupt. We have a question actually from the previous machine,
Yeah?
from Dr. Ramirez from Mexico,
Yeah?
asking if you use this for every protocol that you use instead of aesthetic medicine as well as surgery.
Yeah. I'm using the 3D motion for all my patients because it helps me explain them, so they understand better the protocols that we do, and they can see better results. And as I store all the images, and that helps me also see how long it lasts. And that's what's interesting with this protocol, is that the volumizing product from Filmed is an amazing product that will last more than 18 months. So basically, the patients can have a good result for a long last.
Thank you very much. And thank you to all of your Mexican doctors always there with us.
So, we were saying about the drawing. We are going from top of the ear to the nostril. You just draw the line. As you notice, this line is exactly the line that makes the middle of the bone. Then you have a line going from the corner of the eye to the nostril. That's the first one. And then the parallel to this line that will go to the corner of the mouth. So here you will have, this is the region that you want to inject. So if you are in a woman in this case, you will want to shape this region and a little bit more lateral. If you want to go to a man, you will go more medial. It's the same on this side. Could you regardez bien à gauche? Super. Parfait. So here we have the best mandibular angle possible. It's this one. And you can see she has lots of loss from here to here. So basically that's where we want to inject the most. In her chin, tout droit. In her chin, you can see that here there is a little bit of volume, here a little bit of volume, so you want to make it rounder, so you'll stay in the middle. You will want to make it really round here. So this will be the deep in points, the structural points. In her case, as I told you, it's an adaptative protocol. Tournez un petit peu à gauche. In her case, what we want to do is to melt the bone to the rest. So we'll do 1-2 boluses deep to the bone, and we'll stay deeper with some volume. So in the end, we'll go for the skin quality, and then we can use the entry points of the mandibular line or the cheek to prepare and to treat all the skin with the NCTF, which is the biorevitalization product from Filmed. Good to go?
Good to go.
So, what we...
Everyone is quite excited to finally see it, to be honest.
In fact, what's really interesting about... I love to work with the Filmed products. You know, they're very good products that are made in Europe, and they have a really great control of the quality of their products. So that's something very important to me, because it's easier to work on products that are safe. And another interesting point is that their products come into 1.2 milliliters, which helps you because in her case we'll use 2 or 3 or maybe more syringes, so you'll have 0.2 milliliters more every syringe, or every 4 syringes you use more than half of one. Every 3 syringes is like you have 3.5. So it's more product for the patient, so basically better to treat them. So we'll start to treat the temple area, okay?
Question for Lithuania.
Yeah?
Dr. Mihai, what is the cohesivity of the product you're about to use?
It's a high cohesivity product, so that's something very important. The cohesivity of the volume is really high, but also her properties are good, and it's really easy to mold. When you inject it, you can really feel that you have the product that stays in the place, and when you press it with your finger, it spreads on the pressure. But then, since the cohesivity is really high, it will stay exactly where you want it to be. It won't migrate. So that's a really good question, and an important one.
Thank you for your explanation, and thank you, Lithuania, for following us tonight.
So, for example, look, we'll treat the temple area. In this side, we'll go with a needle. So the volume from Filmed comes with a 27 gauge needle, and it's a special needle. It's a thin wall needle, which helps you make a retraction and an aspiration to see if you are in a vessel. So in her case, we'll go with the needle straight to the bone. We'll be exactly in the middle. Respirez bien. And you'll go slow, slow, slow until you have bone contact. And now we have bone contact, and you can see that you still have like 3 or 4 millimeters to the needle. And then, if you want to make the aspiration, you can make the aspiration, but there is no risk here since you are close to the bone. And then starting to inject really slow. You can feel the bubbles of a little bit of air, but then you inject really slow.
Dr. Johnson from South Africa,
Yeah?
can I interrupt?
Sure.
Could we do the same injection with the cannula?
Sure, and that's what we'll do exactly on the other side to see the differences. In fact, when you inject it with a needle, the product goes really deep, close to the bone, and it will spread in the muscles. So all the muscle will be pushed. And it's a very safe technique, easy to inject. I will say that the Injection with the cannula is more complicated. It's, I would say, more advanced, because when you inject it with the cannula, you have to be in between the two fascias, the superficial and the deep temporal fascia. So this is an avascular plane, so it's really safe, but it's quite hard to get into it if you're not used. As I'm speaking, I'm still injecting really, really slow. And all the product is going really slow. And that's something that is really important. You really have to take your time for the product to go inside. Perfect. I will change a little bit my hand so you can see. Really slow.
So quick follow-up question.
Yeah.
From a beginning doctor from Mexico,
Yeah.
Dr. Rami, asking if for him, as a beginner, it's easier to try it using the needle, not the cannula.
In the temple area, it will be easier for him, but I will show him a few tips and tricks that will help him try even with a cannula. And it depends on how you feel comfortable. So we treated the lower part, and I still have a little bit of product. I will go a little bit higher because she really needs this region to be filled. Really slow, slow, and close to the bone, you see? You see the difference how the bone goes? And while I'm injecting, I inject it really slow. You can see that the skin is coming up. It's coming up the needle. That's something very interesting. So we just used the 1.2 ml on one temporal region. So that's quite a lot of product, but she really needed it. And that's something very important to her. The temple region is perfect. And when you adapt your protocol, it's really nice to make a good analysis of the face. For example, she doesn't need that much product on the chin, just a drop to make it rounder. You will use most of the syringes on the temple area. And it's a protocol that can use a lot of product, but you can also do it with one syringe or with two syringes, if it depends on the budget of the patients, of course. And then you only have to share your product in between the zones that you want to treat. And that's when the analysis of the face is really important. So, perfect. First side, temple region is good. Now we'll go to the cheek zone. Perfect. To the cheek zone we'll give the structural points. So I will use the entry point exactly where we said, on the line. Just go really slow, and you see again she has lost a lot of structure. So injecting really slow, we'll go with 0.2. In her case, 0.2 ml. It's the same 27 gauge needle. And you see, that's the first one. And since we want to reshape the face more laterally, as we said, because she's a woman and we want to make a rounder face, we'll go more lateral. With the second one, it will be deep. You can stop a little bit of aspiration. You can stop at these 2 points if you want. But in her case, we can go a little more laterally because really she has a lot of loss on her lateral part. And we'll go with the third one, more lateral. Perfect. You see, we are close to the bone. I don't know if you see it on the screen. You really are. She really has lost a lot of volume. Is it painful? Ça vous fait mal? Ça va?
The
Super.
patient is saying it's not painful so far.
Perfect. So, we had 0.6 on this side. Now, what we want to do, yes?
Sorry to interrupt again. We have a question from Dr. Bolozov in Bulgaria,
Yeah?
who wants to ask if you could remind us the quantity that you used for
Yes,
the
sure.
product.
We had the 1.2 on the temporal region, and here 0.2, 0.2, 0.2. So 0.6 totally.
In total.
Yeah,
Perfect.
sure. And now we'll go to the mandibular angle. And this is an interesting case because basically here you will want to inject it with a needle. And what we want in her case is to make it a really round. So in her case, I would prefer to use a cannula because I could bend it a little and then make it really rounder. So we make the entry point, a little bit of antiseptic on the skin. So entry point. You don't need to go really deep, slow. Of course, in my practice and here too, I use numbing with lidocaine. I think it's very important for our patients to feel safe and not feel any pain, because if they feel comfortable, they will come easier for a second treatment, you know. That's something really important. So, in this side, we'll go un petit peu de ce côté. We'll go from the entry point, and we'll go quite deep, and we'll use another 0.6, 0.5 on this side. You don't need that much. In fact, injecting the mandibular angle, I know that it's quite a trend now, but it makes the jaw quite square, and that's more of a male archetype, having square jaws. So we need a little bit of reshaping, but you don't need to inject that much.
Sorry, I'm going to bring this back a bit because we have so many questions on the temple zone.
Yeah, sure.
So one of them that's quite summarizing up, it's from Germany, Amman.
Yes.
And Jordania, of course. And it's just to know where you can actually inject on the temple region.
In fact, the temple region is quite a safe region to inject. If you are deep to the bone, it's safe. The only region that can be more dangerous, it's close to the bone here.
But on the temple region, how can we select the best injection points?
The best injection point will be, let's say, you divide it into two zones, okay? The superior half would be always safer. So you will want to stay on the median region or a little bit higher. So that's where the safer region will be.
Thank you so much. And again, thank you doctors from Jordania for following us.
If it's not clear enough, I will try to say it differently. I'll show you on the other side. In fact, what you want is to represent the temple as a volume, and you will have the emptiness to a horizontal plane. You will choose the entry point will be the point that is the deeper, so the more empty point of the temple. So that's how you will choose. So here, look, we had a little bit of injection with the cannula, and I used a 25 gauge cannula. It's a soft fill cannula. Its length is 5.5 centimeters, and it was specially made for fill med because it's a little bit longer than the classical 5, and it helps you reach all the regions of the face with on entry point. You see, from the same entry point, you can be close to the more anterior part of the face. So now we had a little bit on this side. We'll go just a little more. Tack. Perfect. Okay, so now we finished the injections on the cheek, on the mandibular angle, and on the temple region. Now we'll start to use the NCTF. The NCTF is the polyrevitalization solution from Filmed. It's the oldest polyrevitalization product in the world. So it has now, I think, 50 years old. So it's the best in the world because it has so many ingredients, like 50 or some.
Another question just for Mexico. For the NCTF, how many quantity did you use for the jaw?
I will use the whole vial at 3 milliliters on one side. And I will start to inject it really slow and just under the skin. We have studies now that show that the injection of the NCTF is exactly same efficiency if you inject it with a cannula or if you make it in mesotherapy, because the skin cells will feed themselves by imbibition, like drinking from the deeper layers. So you can see my cannula, I'm really superficial, and I will stay superficial, and I will just inject it to prepare the skin. Really, really slow. Tack. In fact, I make my passages under the skin. The passages will have also a traumatic mechanic effect, so it will help the neocollagenesis. And then, while retrotracking, I'm injecting the product.
Another question, Dr. Guzman from Mexico.
Yeah?
This time about the volume.
Yeah?
And again, for the quantities you use.
Generally, there is no specific quantity. I will adapt it to the patient. Let's say a patient comes and say, I have the budget for 3 vials. You will share the 3 vials in the regions that you want to inject. So you will decide if you want to use more to the temple, more to the cheek, more to the mandibular angle, more to the chin. It depends on the patient. In this particular case, we'll have 0.6 on the cheek, 0.6 on the mandibular angle, and 1 ml on the temple region because her temple was the one that needed the most. So if we stay like this, we'll have like 2.4 ml on one side and 2.4 ml on the other side, with 1 vial of NZF, 3 ml on one side and 3 ml on the other side.
Thank you.
And now we are almost finished. It's just a little bit more, the last drop of the NZF. Tack, and that's here. Perfect. Okay. When you finish, you can massage it just a little bit. Tack. I will remove the lines so that you can see the difference between both sides. And we'll make the patient sit so that we can see properly. She has a really thin skin and it's really sensitive. So you will see that she has a little bit of redness, but the result is quite amazing. Asseyez-vous un tout petit peu et vous regardez la caméra devant vous. Look how different is already. Baissez un tout petit peu le menton. Super. Et tournez la tête. Ils vont avancer un petit. Just a little zoom. You see how different is the face? It's like she has 2 different sides. So that's a very good result. And if you look around on this is how she looks on this side. And this is how she looks on the other side. So, of course, she could have a little more, but not that much. With some biorevitalization, she will have a better tightening effect on the skin, so it will help her over time. So in her case, this protocol, and in all the cases of all the patients, it's a very good protocol because when patients start to understand that skin quality is very important, they will come back for methatherapy and you will use another vial of NZF, and it's a very good way of doing the business, you know. It's like they come and they have good results and they come back and they are happy and then they come back and they have good results. So if you want to treat skin quality, the patients have to come. So I think that's an important thing, guys. When you do this protocol, just tell your patient you need to take care of your skin. The skin quality is very, very important and you have to come back, and that's a good follow-up, and then they're happy and so on. We'll go to the other side.
Quick follow-up question from Stockholm, which is, what could be the immediate or later complication following the injection, the ones you just did?
Yeah, for the NZF you have, I would say, no complication at all, because you are superficial, you inject it with a cannula, so no risk. The injection with the volume, if you inject them with a needle, the only risk is to inject it in a vessel and to have an emboli, but you do the aspiration, and that's what I insisted at the beginning. It was something maybe that went a little bit slow, but having thin walls and needles, it's really efficient to make the aspiration. So if you make the aspiration, you're sure you're not in a vessel, then you can inject. So that's very important to have these high quality needles in the boxes.
Thank you very much.
This side will do exactly the same. Tac. On va le faire un peu comme ça. I will just make... I will not draw them, just use the points. I will stay here. And this is the temple region. And the same here. Okay, so we said we will inject the temple region with another technique on the other side. Let's see how we do it. On this side, what you want to do, I will come on the other side, it will be easier for me, is that you want to be in between the superficial temporal fascia and the deep temporal fascia. You will use exactly the same product. I think it's very interesting to use this technique. As I said, it's a little bit more complicated, but it may help you lose a little bit less product. So you'll make an entry point. You can make the entry point up or down. I prefer to use it to make it close to the hair, to the hairline, and then you go through the skin. Now I'm under the skin, so this is very important. I go deep, since I see the first tremulation of the muscle. Now if I lift it, I can't. So it means I went through the superficial and the deep fascia. Now you take your cannula, you start to see the bleeding point, and now you will try to find with the tip of your cannula the entry point in the fascia. So that's when you have the first resistance here. You see I push and nothing happens. And then you turn your cannula until it goes through the first fascia. Now it went through the first fascia. And then, since you are here, it becomes really easy to go, you see? I don't make any effort, and when I lift my cannula up, you can't lift the tip, so it means you are behind the fascia.
We have a very good question from Chile. Since you're using now two different techniques on the face, on both sides, aren't you afraid that you're going to have different effects, different results with the cannula here than what you just had before?
Well, it's a very, very good question, and I really like it. There is an interesting point that I love to do in my practice is to make my patients notice their symmetry. I don't know if you noticed her asymmetry at the beginning. So basically, you don't have any patients that are totally symmetric. So trying to correct the asymmetry is a very good point, but you'll never succeed. And in her case, I know that I will use a little less product in between fascia than deep. So that was planned, and I will not use the 1.2 ml on this side. I will use a little less. I will use around 0.9 and save the 0.3 for the chin. That was the plan from the beginning.
Thank you very much.
Ça va toujours?
Ouais.
Super. And since you are deep, you are safe. And she has this really... This injection is a little bit tricky because if you go up, if you go out too much, you can go outside the fascia. So here we have the same. Now you see I'm out of the fascia. I can't go inside again. It's still, so I have to turn it back again just to go through the first one, and now I'm good. Up, and now it goes easy. Perfect. It's harder for me to stay on this side, but it's good for you guys to see it. So, injecting the temple with a cannula, it's a more advanced technique. You see, in this case, I'm almost finished, and we are at 0.6. So, you see, it really uses much less product with the cannula, on my opinion, but that's something that I do for a long time now. And I will go just to finish exactly the region as I wanted. Perfect. And we are to the 0.9 as planned. To answer your previous question about the asymmetry, all the time it's good to see your patients for revision, like for 15 days. It's good even if you don't do nothing. Even if they come and they say, it's perfect, I'm happy to see you, how are you? That makes your patients feel that you care about them, and that's, I think, really important. Okay, this one is made. Now...
So, just before we start again,
Yeah.
a quick question for the patient. Pour savoir comment vous en sentez, how she feels, if it hurts, and if it was worth using the cannula or the needle. Est-ce que un côté a fait plus mal que l'autre ou pas? Est-ce que vous avez mal et comment vous en sentez?
Non, alors ça fait pas mal du tout. Franchement, le médecin est très doux.
So nothing hurts and she's very happy with Dr. Gorj.
She can't say nothing because we didn't finish yet.
Of course, like he said, he still has the needle.
Yeah, so here we injected with a needle. Now you can do the boluses. I will come on this side. It will be easier for me to show it. I've drawn the boluses that I want to do. It's one here, and one here. So I will make an entry point more lateral of this point. Here. Respirez bien. Then you will take your cannula. I have the 0.6 in my syringe, the one that remains from the other side. I just put the cannula, and now I go deep. I go deep, 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 deep. And if I go too far, I will feel it under my finger here. And then I will make the first bolus 0.2.
Question from Varsovia
Yeah.
in Boulogne. Can you please explain the plan of injection, please?
You are deep, close to the bone. Here, you really go close to the bone, the closest to the bone you can. Because it's a high cohesivity product, you don't want to be superficial, and it's a very volumizing product, but also it's really, really easy to shape. So if you inject it in the non-mobile fat, so deep, close to the bone, it will be really easy to mold, and you will have exactly what you want in terms of results. If you are too superficial, you can have some irregularities and maybe a little bit of not that good result.
And so do you actually feel the bone or touch the bone with the cannula?
Yeah, sure. When you entry, you just go on the contact with the bone, and then you move slowly. So, sure, you won't be as deep as a needle, but you will still be in the good fat compartment that you want, the deep one. Now we have the...
London, England, sorry to follow up.
Yeah?
What are the risks here?
No risk. You are safe with your 25 gauge cannula, so basically no risk.
Thank you. And thank you everyone for all of your questions tonight.
And here is the last entry point. I will make it here. Respirez bien. Hop. Super. Ça va, ça se passe toujours bien. Ouais. Perfect. And we have the last 0.6 here. So drawing the mandibular angle. And you see, if you want, you are quite deep. Also, when you lift the cannula, you see you have a lot of tissue under. It's not a dangerous region here. Nothing can happen with the cannula. It's quite safe. Same here, quite deep. And going back and pushing on the syringe while retrotracting, while getting out of your cannula, you're pushing, keeping the same pressure Yes, that's it. And just to finish here.
So we have a question from Madrid in Spain. So you talked about asymmetry of the face.
Yeah.
The question is, however, when you inject on both sides, how do you make it symmetrical? How do you judge for it?
That's why I used the 3D motion capture before. It helps me see the differences in the face, and it helps me see if a cheek is higher than one to another, if a temple region is more empty, if all the asymmetries. And then I'm planning. The planning is the most important thing in the protocol. So basically, if you want to sum up, it's quite easy. You want to inject some really deep tissue. You have the temple region, the cheek, the mandibular angle, and the chin. So let's say you have 2 syringes and you have to use them. You will first decide if you want to use more on the temple, cheek, mandibular angle, or chin. In her case, she has a good projection of the chin. So you don't need much product. You could hardly use it. You just want to make it a little bit rounder because you see there are some irregularities. So I will only use 0.2. The most she needed was on her temple region. So that's why I kept the most of the product. And that's how you plan it. The planning is the most important thing.
Thank you very much.
And the last, so we have now, we'll go for the NCTF. And for the NCTF, I will come on this side. Tac. Ça va? Toujours bien? Super, on a presque fini. On ne va pas vous faire souffrir trop longtemps. Ok. C'est là où c'est un peu compliqué de le retrouver. Il est là. Perfect. Hop. And now I will stay superficial, as I told you. You see the difference on the skin. Now I'm really superficial. You can see my cannula. Tournez un petit peu plus la tête de l'autre côté. À droite. Plus, plus, plus.
You can really see well on the screen.
Yes, you see. You're really superficial. Hop. And retro-tracking. So this is the biorevitalization product. And I go up. Tac. You see, that's the advantage of having a longer cannula. You can go really high. Tac. Respirez bien. C'est presque la fin. Et c'est un peu plus désagréable celle-ci parce que je racle. When you have a good numbing of the skin, if you use a good cream, anesthetic cream, you can make more passages under the skin, so it will help irritating the skin and enhance the collagen production. Okay, good. We finished the NCTF, and the last injection will be the chin. So with the chin, it will finish it. Perfect. Okay, and now the chin, and we are good. So the chin, on her case, will be really simple. We have the 0.3 with the needle. That's something I will show you now, guys. I will show you some tips and tricks for the chin. This is very, very interesting. You take your finger, you go on the bone, and you feel when the bone is going down or up, down or up. What you want is to be on the lower side if you want the projection to be lower, on the upper side if you want to have more frontal projection. In her case, we just want to make it round. So you have to be straight on the edge. You go straight on the edge, and that's it. Now, if you feel it, if you can see it from with the camera, you have like more than half of the syringe, half of the needle on up, and you inject really, really slow, and you can see that the skin is going closer and closer to the syringe. And as I told you, it has very good cohesivity, but very good moldability, and that's why you just press it, and it's done. You can't feel it, nothing. And we're done. We just used all our products. The plan was perfect, and we are good to go. So let's see how we make the good analysis. We've been injecting 4 volumes. So that, yeah.
Sorry, from Morocco, I think you mentioned it, but how long after do you see your patient for a follow-up?
I like to see them like 15 days after, or a week. Let's say a week to 15 days. That helps me speak with them, speak about their experience, about the pain, about anything, and make the further planning. Then I will say you will have to come back in 2 months, continue the skin quality, and we'll do a methodotherapy or something, or we'll plan the rest of the treatment. For example, I don't know, the TTRF or something else, and that's good because they have a little bit time of thinking. They will have the feedback for their relatives or friends and stuff, and that I think is good. And yeah, that's it basically.
Very clear.
Let's see the result. Can you see it? Parfait. Good. What I wanted to do now is to take some pictures on 3D motion to see the difference before and after. If we have a little bit of time. Yeah? I don't know. Sure. Let's do it. Let's try.
So, while we set up the 3D, can I ask you a couple of the questions we've been having?
Sure.
Okay, so from Dr. Abel de la Peña from Mexico, if you had to inject the upper lip, which you didn't do, obviously, but what product would you use?
Well, it depends on on what the patient wants. You know, if the patient wants more volume or more hydration, or it really depends on what the patient will want, and I would say I will inject a fine lines from Filmed, which is the best product for hydration for younger patients who really want just hydration and not that much volume. I will inject Universal or Lips if they want more volume.
Thank you very much.
Sure.
And thank you again, you doctors from Mexico. Very active tonight.
We have just a little thing with...
And so far,
Yes.
attendez. Je vais prendre un miroir.
Bien sûr.
What do you think about the results? Do you see the big difference? What's your take?
Oui, les joues sont beaucoup plus pleines. C'est ce que je remarque en premier. Et le menton aussi. Les joues et le menton. C'est ce que je vois le mieux.
She's very happy and she can see right away the results on the cheek and on the chin as well. Et ça ne vous a pas fait trop mal? Did it hurt?
Non. Non, franchement, ça ne m'a pas fait mal avec l'anesthésiant.
Parfait. Very good job, Dr. Gorj. Thank you very much. Quite amazing work.
Thank you. And that now I'm still trying to prepare the camera. We'll have just, you always have some technical issues when it's live.
Of course.
It
Otherwise, it's not funny.
Sure. Well, I'm preparing it. I will change.
So, from Mexico again, while we wait, can you please tell us about the post-procedure care that you recommend?
Yeah, on post-procedure, I tell my patients I tell them to avoid, let's say, I tell them to avoid heat, so no sauna or hammam or all the hot things that will make all the blood rush in the face. And basically, they can use makeup from the next day. It's not a problem. They can also massage the regions. There is no problem with this. So no any special contraindication.
Very clear. And so now from South Africa, about the upper lip again, could
Yeah.
you have used NCTF there as well?
Sure, that's a very good for hydration for younger patients. For the millennials is very good. Sure. Or for the skin revitalization of the barcode, you know, for smokers, it's also very, 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 very good. And I'm sorry, I don't know what happened, but
Let's just check.
yeah. So this one already is in here. Tack.
Very sorry for the delay. We'll be right there.
If they want to see it. Okay. So good. It will be good to go. Okay. Perfect. I will take the picture and I will put it. Okay.
If you can just wait for a couple of minutes,
Yeah.
we're just gonna get a technician because this is working. We just need a feed for
I know.
viewers right now.
Just don't move. Perfect. And the last one.
So while we wait and you take the pictures for the 3D, we have another question from Jordania. So before you finish, could you please inform us what we can do with the art filler for your patient? Something else, for example, would nose job work or anything like that?
Sure. For the nose, you can use the Art Filler Universal. It's very, very good for reshaping the nose. So for medical rhinoplasty, it's something very good. The Universal is an amazing product because you can use it in all the situations. It's a good product for deep injections and for more superficial injections. You can use it for the tear trough, you can use it for the lips, for the nasolabial folds, for everything. Like, it's an amazing product. And it also comes, like, you know, in 1.2 ml. So it's good. If you use 2, you have 2.4. It's good.
Perfect, thank you. So now we're back on screen for the 3D. Thank
Yeah.
you to our technician Ruben for helping us figure it out.
It's just processing now, and we'll have just to wait a few seconds, and then we're good to go.
So how many pictures did you take to get the full 3D?
Yeah, you have 3 pictures, but basically every picture takes 2. So every picture will have a third 3D of the face. You can see it, the face and the other side, and the software will make them all together to have exactly the same face, and it has precise spots. And the detection of variation of volumes is 0.1 ml. So we'll basically see all the injections and all the differences in volume.
Great. So while we wait a bit more, I have a question from Romania.
Sure.
So what do you recommend for lower eyelid wrinkles, and what do you consider to be the best treatment?
It depends on the wrinkles. One great treatment will be the NCTF.
Can you please show us on the patient?
Yes, sure. For
Thank
example, the NCTF, you can, let's use the pencil. You will have it, all these wrinkles, you will inject them here, 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 in small papulas, and then you will have a very good result. But you'll have to do at least 3 or 4 sessions spaced with the first, let's say, 15 days to 1 month. Okay.
Thank you.
Yes, just a minute. Good. So this one is here. We have to just show her the important
As you can see on the
points.
screen now, we are using the Vectra tool right now, the software.
It will show her the eyes, the nose, tip of the nose. So
what are you doing right now on the Vectra tool?
I'm showing him the key points. And
So Dr. Gorj is now going onto the tool to show the key points to insist on so we can see the results.
he has to, the software has to match it because we didn't have exactly the same light conditions on the before pictures and now. So I helped him recognize everything, the eyes, nose. And then when he has the precise points, he will.
Great, thank you, very clear. So how long does it take to process?
Let's say a few more seconds, and we'll have the result on 3D, and then a few more to compare them.
Wonderful.
Ça va? Parfait, il n'y a pas de bleu. She has no bruises, as you can see, with all these injections, so it's quite good. And yeah, she could have a nice makeup and go out tonight.
Yeah, for sure. While we wait, I'll just ask you another question from Romania again. Can we combine the universal filler with NCTF in one syringe and inject it for voluminization?
Yes, that's something that you can do, especially for the hands. It's very good for rejuvenating the hands because you have a lack of volume and you also want it to spread easily. And I think it's good when you melt the universal in the NCTF, you had more fluid product with almost the same properties. So basically you can do it if you want, sure.
Thank you so much.
It will help spread in the tissues.
Very clear.
It's a little bit more time to wait and we're good.
So just to summarize, can you please give us the benefits of the treatments that you did today?
So basically the first point is that we treat the structure. The structure, you have the deep, non-mobile fat. So that's the boluses point. You treat the skin quality and then the global shape of the face. So you treat structure, shape, and skin. Good to go.
Oh, so let's go for the 3D now.
So
Exciting.
that's the result right now. And as you can see, all the face is it looks more rounded, more rested. And now what we're going to do in just a few seconds, we'll use all to compare the first one that we had, this one, and the new one. And now we'll compare them and we'll have exactly the results in just a few seconds of both the before and after.
So I'll just ask the last question because we have so many and it's almost time out. Just so you summarize the benefits, can you just retell us once again the quantities you used, please?
Yes, we used 4 vials of volume from Filmed. We used 1 on each temple and spread half and half for mandibular line and for cheek on each side, and then 1 vial of NCTF on each side. So basically it's a 6 vial protocol on her case. So just a few more seconds and we're good to go. Perfect. So you see that's why he didn't recognize it, because she had not the eyes on the same position. But as you can see,
this is amazing how we can see the results on the 3D.
Yeah, you can see that all the region is improved with all the treatment. You can see it on the temple region here, that there is a really big difference on the temple region. And all the region, you see all the wrinkles here, there are no more.
Do you give this after and before pictures to your patients when they leave?
If they ask me, yes. If no, I keep them. Sure. But I think it's really nice to have them. And what's also interesting is if we go on the volumes, you can see the volumes that we injected, and you also have the lifting effect. You see, in the blue color, you have the volume that has been injected. You see, and the yellow, it means that this region has been lifted, because it's a little bit lower. You have a lifting effect. So you see, basically, you have the lifting effect of the injections on the region that you wanted to have the lifting effect. So I think it's great. That's what we wanted, and that's what we have.
Really amazing and great results. So just before we wrap up, I'll just go ahead with one last question from Mexico. Would you combine the BioNutriShape protocol with botulinum toxin at the same time?
Yes, you can. Sure. Not a problem.
Great. Thank you so much. So thank you, Dr. Gorj, for this amazing results and for this 3D that has been with us tonight.
Thank you. Thank you so much for having me here. I'm really happy to be here with you all the time.
And thank you all for following us tonight and for all of your questions on our live chats. It was a pleasure having you tonight with us. So thanks again for everything, and see you again for our next live chat on October 15th. Have a great evening.